So this danger alarm mechanism in the brain is triggered by fear. The more fear, the more pain. The more pain, the more fear. And that's the vicious cycle that chronic pain is for most people.
Welcome back. You're watching the Dr. Nandi Show, and today's show is called Please Make My Pain Go Away. Now, short-term pain, for the most part, is fine, as it's your body's way of letting you know that something's happening, right? But chronic, long-lasting pain can negatively affect your life in so many ways, making you feel miserable, depressed, anxious, unable to work or accomplish typical tasks. At times, you may think it's all in your head, that you have a mental condition, right? And that's exactly what my next expert is going to address. He's a medical doctor, a friend of ours in the show, and the director of the Mind-Body Medicine program at the Providence Park Hospital. And here to talk about brain-generated pain is Dr. Howard Schubiner. Dr. Schubiner, thank you for joining us.
Good to see you again.
We appreciate it. Yeah, thank you. So two types of pain. Tell us about that. There's two types of chronic pain, right?
Well, you're asking the right question, because as a doctor, you know, if you get the wrong diagnosis, you get the wrong treatment.
Correct.
And most people don't really understand pain. Most doctors don't really.
Right, absolutely.
All pain is actually generated by the brain, by what we call the danger alarm mechanism. And obviously an injury can trigger that. But the brain can generate pain in the absence of any tissue damage. And I've had this. I've had neck pain due to my brain and stress. I've had back pain. You remember being an intern? When I was an intern, I had 6 months of diarrhea.
Wow.
And, you know, to be frank, being a doctor scared the crap out of me.
Yeah. So what's this brain-generated pain? Is it rare?
When you think about the causes of chronic pain, headache. Millions of people with migraine and tension headache. Neurologists all agree, very small percentage of those people have structural disease in their brain, in their head. Fibromyalgia, experts agree, no damage in the body, but very real pain. Irritable bowel syndrome, no damage in the gut by definition, as you know.
Mm-hmm.
And then when you get to back and neck pain, it's surprising, but studies show that about 85% of the people with chronic neck and back pain don't have a serious, clearly identifiable structural cause for their pain. And that's shocking.
That's unbelievable. And people, when they have this brain-generated pain, how can they heal from it? How can they treat this type of pain?
Well, the first thing is making an accurate diagnosis. The vast majority of adults have abnormal MRIs of their neck and back who have no pain. And so when you think an MRI is going to show you the cause of your pain and you have mild changes that everybody else has, when you think that that's the cause of the pain, that generates more fear. So this danger alarm mechanism in the brain is triggered by fear. The more fear, the more pain. The more pain, the more fear. And that's the vicious cycle that chronic pain is for most people.
Yeah, and that danger alarm mechanism is a bit like your fight or flight mechanism, is it not?
Exactly.
I mean, your body's giving you like danger, danger, something's happening. We actually have a question, they tell me, from a viewer from Toronto, and it says that I've had pain in my neck, but the MRI shows no physical injury. I'm confused. If I'm in pain, shouldn't it show damage? This is so common, right? Because people get these MRIs, CT scans, all negative. They go, what the heck's going on? Where is the damage?
Exactly.
Now, what do you tell patients when they come and tell you that?
Exactly. What we're doing is making an accurate diagnosis. And I spend a lot of time with people listening to their story in detail. When the pain starts in one area and it's spreading to all these other areas, chances are the brain is causing that. When the pain is on one side of the back and then the next day it's on the other side of the back, chances are that's not a structural disorder. And so people who have this kind of situation, plus they have other stresses in their life, history of anxiety, history of other things in their life such as headaches or irritable bowel, etc. When you put it all together, then you can make an accurate diagnosis.
That's awesome. Dr. Schubiner is amazing, and if you'd like to learn more, Dr. Schubiner has written several books. One of them is called Unlearn Your Pain, and I got it right here, a 28-day process to reprogram your mind. It's now time for another break, but please don't go away. We'll be back with my prescriptions for your pain relief. Please stay with us. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.